This film is intended to educate women about breast cancer risk and to present information about new options for helping to reduce that risk. It includes information on a medication called Nolvadex, tamoxifen citrate. Viewers should note that this medication is only appropriate for women over 35, whose medical profile puts them at high risk for breast cancer. Most women won't fall into the high-risk category and thus won't be candidates for Nolvadex. The women you'll meet in this film were chosen because they have real and very moving stories of how breast cancer has affected their lives. These stories are individual stories and are not meant to be representative of the usual course breast cancer takes. Through methods of early detection, including mammograms, clinical breast exams, and breast self-exams, the cure rate for breast cancer is currently quite high, and women with breast cancer are living longer than ever before. By giving women new information and by clearing away certain myths, it is hoped that this film will contribute to the exciting progress being made against this disease.
Hi, I'm Dr. Marisa Weiss, and I'm a breast cancer specialist, president and founder of Living Beyond Breast Cancer, a nonprofit educational organization dedicated to women who've had breast cancer. Breast cancer is one of the diseases women fear the most. That's why it's great that you've pushed your way past the natural anxiety we all feel and picked up the phone to call for this video. In this video, you'll learn all about the risk factors for breast cancer and about a new way for you and your doctor to assess your own personal risk. And you'll learn about a medication called Nolvadex, or tamoxifen citrate. Now we're going to join a group of women and Dr. Dina Harris, an obstetrician gynecologist in New York City, will be with them as they begin to learn about their risks and their new options.
I think we could start by introducing ourselves. I'll go first. I'm Dr. Dina Harris, and I'm an OBGYN in New York City, and I'm a mother as well, and I'm just afraid about breast cancer as any other woman. Roberta?
My name is Roberta, and I have to tell you about my age. I'm 49 years old, but for the past year I've been telling everybody that I'm 50 because I want to get used to being 50. And I'm very healthy, and I want to stay that way, and it's very hard for me. I don't like talking about breast cancer. It's a tough subject for me.
I'm Marjorie, and I'm 54 years old. I'm very concerned about breast cancer. However, I'm very healthy, and I think if I just keep my positive attitude, I'll remain so.
I'm Virginia. Oh, God, I have to tell my age. Yeah. It's hard to come out to, 61. I'm kind of in denial about breast cancer. I don't like to think about it either. So that's why I'm here to be more healthy about thinking about it. Yeah.
I think I can ditto just about everything all of you have said. I'm Trisha, and I'm a lingerie and swimsuit model. I'm 39, and I'll be 40 in February. I can't believe it.
I think it would be interesting to see how breast cancer has affected everyone's lives, if you want to share that.
Well, actually, there was this woman that I didn't even know. I just met her, and she just lifted her shirt and showed me her breast and said, I show this to every woman that I meet to tell them that they should not be afraid of the physical effects of a mastectomy. And they had done reconstructive surgery on her. And she said, this is my mission, to make women go and get checkups.
About 10 years ago, my mother was diagnosed with breast cancer, and she had a mastectomy. And a year later, she had another mastectomy, which was really kind of horrifying. Suddenly it seems like it's on the news, it's in the paper, it's people you know, and it's my mother. I know it's happened. I know that she's doing very well now. She's quite healthy. Her checkups have been excellent, and her recovery has been very good. But I think sitting here right now, what I really know is that it scares me. And it scares me because I feel like it's something inside of me and I don't know if it's going to really happen or not.
Well, my mother or sister, very close relatives, have not had it, but a very dear friend of mine has had breast cancer, and she's like my sister. And I remember when she detected this lump in her breast, and I went with her to the doctors, and after they examined her, and she came out and she said, "Oh, it's bad." She went into the hospital like the next day.
I guess I can say I had a really good friend, and at 30 years old, she had already had 2 children and never any history of cancer in her family. We, at that point, none of us ever really knew anybody that had cancer. And that was something that, just didn't happen. She called her sister one day and said, "My chest is really hard." And her sister said, "Well, Suzanne, you ought to go get it checked." It was breast cancer. It was malignant, obviously. And you don't know why. You just don't know why.
I may be in denial. I don't even think about it. I don't even want to think about it. I had 2 close encounters with breast cancer. One was my mother, who had it detected about 10 years ago, and she had a mastectomy. And she seems to be okay. She's 84 now. But my friend, Lee, said for years, 3 years, she kept saying, "You've got to get me to a doctor. You've got to help me make an appointment. I'm very scared about this." And we were just busy. I don't know. Whenever I would call her, she couldn't do it. And we just didn't do it. By the time she went, it was really late.
It's really scary. I mean, what is it now? 1 in 9, 1 in 8?
The incidence of breast cancer has increased substantially over the years. The figure now is 1 in 9 women will get breast cancer in her lifetime. 25 years ago, it was 1 in 15.
I don't understand how you can just suddenly get breast cancer. I mean, how does it happen?
You don't just suddenly get breast cancer. There's many factors involved, not just one. It takes time. Remember, breast cancer can be caught early with regular mammograms and treated very successfully.
It starts when tiny changes in the genes that control a cell's growth cause the cell to begin to multiply, forming a mass or a tumor. Most breast cancers are detected when they have gone through a number of cell doublings, and that may take years.
It's horrible to think about something growing inside of you.
That's why I don't like to think about it.
How do we know if we're in the high-risk group or the low-risk group?
That's this test we're going to talk about.
Yes, the risk assessment test. First of all, when you think of test, you think about SATs or blood tests, but that's not what this is. It's just a series of questions we ask you about your family history, when you've had your first baby, when you had your first period, things like that.
My doctor already knows all that about me.
This is different. The risk assessment test is a new way to estimate a woman's risk that's been adopted by the National Cancer Institute. It's based on the most up-to-date statistics regarding who gets breast cancer.
When you take the test, you get a number. The higher it is, the greater your risk of developing breast cancer. A number of 1.7 or above means you're at high risk. You and your doctor will want to consider whether you might want to go on Nolvadex therapy.
Of course, this prescription drug is not for every woman. It's only for women over 35 who are at high risk, and even then, it's not for every high-risk woman. You and your doctor should decide based on your personal situation. If you're planning to become pregnant soon or have a history of blood clots, for example, you shouldn't take Nolvadex. So, what do you all think your own personal risk is? Anybody?
Nobody in my family has ever had breast cancer. It's been all heart attacks. No way am I going to get it.
My mother had breast cancer. I'm just waiting to get it.
Well, isn't your family history the thing? I mean, like your mother or your sister had it?
Most women are absolutely shocked to learn that 80% of patients with breast cancer have no family history. That may be hard to believe, but it's true.
The family history is only one of the risk factors. Basically, we're all at risk of having breast cancer because we're women, and age is another risk factor. Let's face it, we're all getting older, and breast cancer increases as we get older. Another risk factor is whether you've ever had any breast biopsies. If you've had any biopsies, you should ask your doctor about this. Other risk factors have to do with your exposure to the female hormone estrogen. If you got your first period relatively young, say younger than 12, that would increase your lifetime exposure to estrogen. Also, if you've never had a child, you're at higher risk because you've had your periods continuously without the break that comes from pregnancy and nursing. And again, that increases your exposure to estrogen during your lifetime. The next risk factor is if you've had your first child at a relatively late age, which in terms of breast cancer risk means around the age of 30 or above.
When looking at your risk factors, it's important to remember that one factor does not necessarily put you at high risk. It's the combination of your age plus other risk factors that determines risk. Of course, for every woman, your score will increase right along with your age.
I do want to know, even though it makes me nervous.
It's perfectly normal to be scared, although chances are excellent that you're not at high risk. But in case you are, it's important to know, and to know that there is something you can do. The big news is this medication called Nolvadex. You may have heard it called tamoxifen. It's the only drug that's been approved by the FDA for women at high risk as a way to reduce their chance of getting breast cancer. You probably read about it.
Oh yeah, that big study with thousands of women. I did hear about that.
The breast cancer prevention trial was a landmark study that was conducted by the NSABP and sponsored by the National Cancer Institute. It followed over 13,000 women who were 35 years or older and at high risk for breast cancer. 25% of women in the study completed 5 years of treatment, and most women were followed for 4 years. Half were on Nolvadex, half on a placebo or sugar pill. They stopped the study early because they saw that women on Nolvadex were getting much less breast cancer, 44% less. They wanted the women on the placebo to have a chance to take the drug. Now, remember, Nolvadex is not appropriate for every high-risk woman, and it reduces but does not eliminate risk. Also, the drug's impact on lifespan has not been determined.
Can I take Nolvadex if I'm on hormone replacement therapy?
Your doctor will evaluate why you're on HRT and determine the best course of therapy for you.
Wait, I'm confused. My mother is on Nolvadex right now. I thought it was for women who'd already had breast cancer.
It's been used for 20 years in millions of women to treat breast cancer. It's one of the most studied drugs in the world, as well as the drug most frequently prescribed to treat breast cancer. Women take it to keep the cancer from coming back and to keep from getting cancer in their other breast. That's why researchers wanted to see if it could also stop or delay the development of cancer in women who are at high risk. That's how the breast cancer prevention trial came about.
The reason that I was interested in being a participant in the Nolvadex trial was I wanted to do something that could help me not go through what my mother went through 30 years ago. I wanted to see what I could do to avoid getting breast cancer.
When it came to my own health care, it was important for me to take charge. I knew that I wanted to be proactive with my own health care. I wanted to do whatever I could to reduce my chances of getting breast cancer. I felt that if I went to my doctor and with good follow-up, that was something I wanted to do. It has to be an individual choice, and for me, this was my choice.
There must be side effects.
There are side effects to Nolvadex, some of which are very serious, but most of the time they're fairly minor, things such as hot flashes and vaginal discharge. In fact, many women experience some level of hot flashes.
When I started on the trial, I was perimenopausal, and I was just going into menopause. A lot of the side effects that I have experienced have been very minimal. I really haven't had a bad experience while I've been on the Nolvadex.
As far as side effects go, I was told that there were 4 that I should really look out for. Pain or tenderness in my legs, unusual vaginal bleeding, pain or fullness in the pelvic region, and shortness of breath. These were things that I needed to let my doctor know about right away if I were to start to experience them.
I heard that your chance for endometrial cancer is doubled.
That's true. Nolvadex increases the risk of endometrial cancer 2 to 3 times, but the risk remains under 1%. And while it is a serious disease, endometrial cancer usually is not difficult to detect and often can be successfully treated.
Most side effects with Nolvadex were mild and hormone-related, such as hot flashes. At the same time, you must realize this is a serious medication that can have serious side effects. Nolvadex can increase the risk of endometrial cancer and blood clots occurring in the arms, legs, and lungs 2 to 3 times compared to women receiving placebo or a sugar pill, but the risk remains under 1%. And there is also a greater risk of stroke, cataracts, and cataract surgery. Women who have a history of blood clots should not take Nolvadex. And of course, the risk for endometrial cancer is totally eliminated for any woman who has had a hysterectomy. Pregnancy is another concern. Any woman who is pregnant or planning to become pregnant soon should not take Nolvadex. To learn more, talk to your doctor or refer to the brochure and the full prescribing information that came with this video.
It's a fact of life that we often have to make decisions based on weighing risks and benefits, and Nolvadex does not eliminate a woman's risk, but rather it lowers her chances of getting breast cancer, and that's an incredible option to have. And though every high-risk woman will not choose to go that route, nor should she should discuss this new option thoroughly with her doctor.
I guess it's something to think about if you find out you're high risk or whatever.
Yeah, I think I'd really consider it.
The first step is finding out if you are at high risk. So what does everybody think about doing a risk assessment test? It's an easy thing to do, and it only takes a couple of minutes.
Seems like a good idea. I probably will.
I'll ask my doctor.
Remember, this test is very individual. Even women with similar risk factors will get quite different scores. So please don't try to figure out your risk by yourself. It's something you really must do with your doctor.
I was really relieved. I found out my score was a 1.0. Can you imagine that? After my mother having breast cancer, I certainly didn't think it was going to come out that way. And I'm so glad I've been doing my annual mammograms, my self-examinations, consulting with my doctor.
I was afraid I was at high risk, and I was right. My score is 1.8, which is high risk, but just barely, so that made me feel better. I'm going to continue seeing my doctor and do checkups and follow this. But you know, when you come right down to it, knowing is better than not knowing, right?
I turned out to be not high risk. I'm a 0.7. My doctor said we'd take a look again next year.
If you are at high risk, the decision to take Nolvadex must also come only after a thorough discussion with your doctor.
Like everyone else, I took the test. I'm a 1.2. I urge you to find out your score just as soon as you can. See your doctor, find out if you are at high risk, and learn about your options, because now there is something you can do. And then, why not pass this video along to a friend or a sister, because every woman deserves to have this important information.
There are several things you must do. Try to make healthy lifestyle changes. Follow a low-fat diet full of fruits, vegetables, and fiber. Limit alcohol use. Don't smoke, and get plenty of exercise. Examine your breasts monthly. Your doctor can show you how. Have regular mammograms on the schedule recommended by your doctor. And be sure to see your doctor every year for a professional breast exam and to take the breast cancer risk assessment test. At that time, you can discuss any further steps your doctor may recommend based on your individual results, including treatment with Nolvadex.
I found out my score was 3.3, so I'm really at high risk. If you hadn't invited me to be a part of this discussion group, I never would have known my score. I never would have known how high it was, and I wouldn't have known that I do have the power to do something about it. And I'm going to talk to my doctor about it. I walk out of here feeling empowered and feeling like I can take part of my life back and do something about it.
Do you really feel that way?
Yeah.